The second day that my son was born, he started breathing very rapidly. They removed him from me and they whisked him away to the NICU. He was very, very sick in the beginning, all with the lines and all the nurses around him, and I got to see him so sick, and I think that it triggered the anxiety. I started noticing that when I was bathing him, I would always be scared his head was gonna go under the water and he was gonna drown. When I was in the car driving with him, I was scared I was gonna get in a car accident, it was gonna kill him or hurt him. I was just ridden with anxiety. My husband, he said, "Babe, I want you to be honest with me. Are you okay?" I didn't know what to do. I just started crying and I said, "Babe, I'm not okay."
She told me on her way to work one morning, she just felt led to come to see me. We're talking about 3 months after she had delivered, she started having these symptoms. It's very important to understand that perinatal mood and anxiety disorder can include anxiety as well as depression and psychosis. Incidence ranges between 11 to 20%. That would translate into about 600,000 females each year. Depending on the severity of the person and their symptoms, it can be life-threatening. I commend Dignity Health for their postpartum depression initiative because it's helping to break down the stigma.
Even as a nurse, I was needing education. Last year, I attended a maternal child health conference that Dignity Health was hosting. They had a postpartum anxiety and mood disorder speaker. She presented the spectrum of postpartum anxiety and mood disorders. I realized it doesn't necessarily have to be extreme where you're hurting your child or you're gonna hurt yourself. I feel like it's my job in this community and my job as a nurse to make this known. We've actually volunteered to be a pilot site to test a postpartum depression screening tool at our hospital. Every mom in the postpartum setting prior to discharge completes a screening tool, and we decide if they need a social services consult or we need to call their obstetrician or we need to do a little bit more closer follow-up when they're discharged with us.
I think it's a serious problem, and hopefully through bringing it to the light, it can motivate those patients to actually come and get some help. It's not something that you wished on yourself. It's not anything that you did. It happened.
And how many more moms are out there just living with this anxiety and not even knowing that they can feel better? Through our education, through our support and community awareness, those patients are more likely to get help. After I got treatment, by the 4th month, I was feeling like a new person. I was feeling like the old Jenny. And my relationship with my kids is amazing.